Welcome to the office. Paul, welcome to the office.
Thanks, Doc.
You coming from down south?
Yeah.
Okay. And you're here because of body stuff?
Yes.
Body pain?
Yeah.
Okay. And we have a few things going on,
Yeah.
right?
Mm-hmm.
And number one to you is the hip?
Yeah.
Okay, let's talk about the hip. Started when?
When I was 6, I was struck by a car.
Okay.
And I wound up in a body cast and also had traction. So there's a pin through here. And then I wound up in a body cast for 4 months.
Okay, and what was the result of all that?
Just that as I grew, of course I was a child, so as I grew into it, I realized that, I can't do certain things. I can't sit correctly or comfortably. I can't stand. Then my back would start cramping a lot.
Okay.
And
what would you do for it?
Back then, they would just give me muscle relaxers.
Okay. So where it started back then, you've noticed it since then, since you were 6?
Every day, yeah.
Every day.
Yeah.
And muscle relaxers was the only
thing I was offered.
Offered, yeah. Okay. What about in the last 5 to 10 years? What have you been doing for it?
I did a year and a half of Bicrams. I did 2 full sessions of Rolfing.
Okay.
I did.
How was Rolfing for you?
Yeah, nothing.
Out of all your treatments, what gave you the best relief?
Just actually another Gonstead doctor that I was seeing.
Right on.
Yeah.
Down in OC?
Yeah, he's great. He's overloaded, and I just thought I'd do some more with you because I need a couple home runs.
Well, okay, fair enough. So you have been maintained. You are being maintained.
Yeah, I'm actually getting better. It is improving.
Okay. Do you know what you're getting adjusted?
Yeah, my
L5
yeah.
sacrum?
Yeah, L5.
L5, okay.
Yeah, and C6.
L5 and C6.
And C5, C6, I think.
Okay, those are the 2 majors you're getting adjusted. Yeah. How long have you been under care?
Probably 4 months there.
4 months?
Yeah.
You're going regular?
Mm-hmm.
And so you are getting some results?
Yes.
Okay.
Only from the Gonstead, though.
Okay. What's different for you for the Gonstead work? You've been to different therapies.
That table with the
knee chest?
Yeah, the knee chest
that
table.
does well for you?
Yeah.
You're how tall?
6'4".
Oh boy.
Yeah.
That's my Bentley right there.
I
got the Corvette next door. I don't know if you may be too big for the Bentley. We may need to go in the Corvette.
All right.
They're both fantastic, by the way. Both fantastic.
I'm like, wow, look at that.
Yeah. This one's got a lot of cushion to it. If we fit, I think we should be okay.
Yeah.
So you do well on the knee chest table?
Yeah.
Fantastic. Okay,
yeah.
Great. Okay, so we are getting a fresh new set of eyes and x-rays, basically, is what we're doing right now.
Yeah.
I'm going to go over your x-rays. I'm going to explain what I see.
All right.
Okay, if you have any questions, if there's any sort of contradiction or questioning, well, hey, I thought it was this or that, just ask.
Sure.
And I'm happy to explain. You do know what the condition of your spine is, though.
Yeah.
Okay, so you already know there's stuff. Okay, fair enough.
It's an interesting
Did
spot.
he tell you about your L5 disc, the situation?
No.
Okay, so why don't we go over this?
Sure.
And let's go, well, hold on, you got this. What's this? You drew me a nice picture.
That's just everything that I've been through that I could remember.
Okay, so let's go through some stuff. Because we'll kind of figure it out. Shoulder, what's this say? Something break?
Oh, ulna.
Ulna break, wrist flexion, pubic bone, hernia enlarged 2016, knee ligament right, knee stretch.
That was a traction pin was located.
Traction pin, sorry, okay.
Yeah.
That looks illegal.
Yeah.
I almost thought illegal. Ilial, quad, psoas, wrist flexion, collarbone, pre-biceps, shoulder, neck. Okay.
It always felt like my ilial or my tailbone was all like compacted. To me.
It's a little different.
Yeah.
Okay, but we're all a little different. That's okay. Let's go over your x-rays and let's see what we come up with.
Okay.
You've already seen this also, I'm assuming you know there's a short leg on the right side.
Okay.
You've been told that?
No.
You had full spine x-rays taken?
Yeah.
Okay, all right, well, this is kind of important. because the answers are going to be here as well.
Okay.
So we have a MD 17 millimeter measured difference from left to right side, which means your right hip is 17 millimeters lower than your left. So that's the first imbalance, Paul, okay? We have PIEX and a P2-L. And let me put this together because it's going to give us part of the answer today. The left pelvis, left side here, goes down and out, okay? So it's going down PI and out EX. The sacrum on that left side is going back, but the sacrum on the right side is dropped down. That's that tailbone injury, the old injury.
Okay.
So altogether what that's done is it's created a situation in your left SI joint. Okay, that's number one, is the left SI joint. Now, what the
My
book...
pubic bone adjusts like 5 times a day.
It pops, yeah. And we'll get to that.
Okay.
So if I'm looking at that, the first scenario is what's going on with this left SI joint. This is where the trauma started. However, the hip is dropped on the right side, so you've been compensating a lot on this right side. So I'm sure you got that little wiggle when you walk. I'm pretty sure you got that. Here's part of the answer. The answer is not your pelvis. If we adjust your pelvis, and if you get your pelvis adjusted, it will actually make the 17 worse to 20. So the answer is not your pelvis. Even though the pelvis is misaligned, that's not where you should be at right now. The sacrum is where the answer is. L5 is an issue, but let me explain the disc and it should make sense what I'm about to say. And before we do that, what I need you to see here is this. You have a lot of scar tissue, dude. Mm-hmm. So here's L5. L5 transverse there, L5 transverse. It's kind of trying to fuse to your tailbone. Okay?
That makes sense.
Yes, so your L5 is trying to fuse. Now if we go to your side profile, you have this little, you see this black?
Yes.
That's called a vacuum cleft sign. Vacuum cleft. When we see a vacuum cleft sign in the disc, right, that black lucency, it means it's dead tissue. There's no oxygen, there's no nutrients, nothing there.
Yeah.
It means it's been degenerated a long time. Follow my process.
Yeah.
You're feeling your tailbone. This is what you're feeling. So that tailbone injury or that fall, this is what it created. So it caused your sacrum to be a little bit higher. That's why you feel that it's up a little. Okay? And this part here is what started that imbalance in your body. Okay? It is what it is. We're dealing with what we have. The idea with what we have right now is what can we keep in balance? And obviously your case is a maintenance case. This isn't someone's going to fix that. I want to be clear about that.
Right.
And the only fixed solution, which they may have told you, is we got to put rods in and fuse it up together. And if they haven't, fantastic. No, but I'm saying is the idea is let's keep the mobility the best we can.
Right.
Fair enough?
All right.
So I would actually start down in your sacrum before going to your 5, okay?
Okay.
And the reason I would be doing that is this. Your SI joint on your left side is still good, okay? There's a little bit of scar tissue on the end here, but look what's happening to your right. All of this is compensating because you're putting all the weight on that right side. We need to get that side up, even if we can a couple millimeters. And the challenge in your case is you're not really indicated for a heel lift. Okay, so that's the challenge, is we got to see how much we can get through that tailbone. And then we can get to that 5. Okay, so this stuff here, this is just telling us that the body's been compensating. This is the calcification here and here. We don't really want to be messing with that area. The concavity of the bones tell me you worked pretty hard, you played hard. That's fine. We need to talk about your digestion. Digestion is off. You have a lot of undigested food that's causing a lot of inflammation in your body. This black hole here, this whole thing should be a big half black circle. When I don't see that and I'm seeing all this undigested food here, okay, that will contribute to the inflammation and the pain. And it will also contribute to the calcification. Now, you can see what's going on here. There's a little kink going on here. This is what's throwing off your upper back and shoulders, and that's starting from T1, 2, 3, 4, 5, T6, T7, T6. So T7 is level. T6 tilts, and then this compensates, so it's misleading. So your T6, and this is the digestion area. The T6 is off on the left, and immediately the body compensates, hits right, and it causes this curve. So it's a little misleading. So I see a T6 as actually the cause of your neck issues. There is a neck issue, I'm not saying there isn't, but the 6 needs to be corrected for your neck to hold. If I look now at your posture, this is another piece of the puzzle. You carry your upper body slightly behind your foundation. The neck, 2, 3, 4, 5, 6. I mean, 6 is degenerated more than all of them. So I'm a little suspect. Let's go to your flexion extension. Extension, no movement. Flexion, no movement. C2, 3, 4, 5, 6. 6 ain't moving, but neither is 7. The other thing that's not happening is you're not really opening up that atlas. So what I'm looking at is the space in here, okay? And when you go back, it goes back. But when you go forward, it doesn't really open up as much. It's like it's pulling you back. This is an interesting finding. You see the opening here?
Yeah.
So that's a nice opening, okay? That's a good opening. And in flexion, it should be touching, right?
Yeah.
And it is. So you go back, it's moving. The occiput I'm talking about. But the atlas didn't move. Look, that's supposed to move also. That didn't move. And now when you go forward, what happens? It's less space than in neutral.
Yeah.
That's an interesting finding. I don't have the answer yet, but we'll figure it out, okay?
Okay.
So far, so good. Makes sense?
Oh yeah, really, your diagnostics are outstanding.
I just want to make sure we understand it. So here's the way I see this case at the moment. I see this as a foundation. We definitely have to figure out your foundation. Foundation, digestion. That's what I see in your case.
Okay.
All of this stuff is all bonus, whatever tune-ups we need to do, extremities, all that, that's fine, we'll do it.
Yeah.
But number one is we need to figure out that foundation. I don't think I'll be working on 5 today. I think I'm going to be down in the tailbone, is what I'm probably going to find.
Great.
Whatever it is, right?
Yeah.
And the other thing I'm a little suspect is upper cervical.
Yeah.
That's 5, 6, it's already worn out.
Yeah.
It's not going to get any more or less at the moment. So I don't see that working on 6 is going to actually do anything for you. It's going to make you feel good, but it's not going to fix anything.
Yeah.
Here's an interesting finding. His right calf is bigger than his left calf. Has it always been like that?
No, I had a calf injury.
On the right side?
Yeah. Hold it like this.
Walk, please. Keep going, back and forth several times. Is there pain when you walk?
No.
So you can see you got the South Coast wiggle. So you walk like this when you walk. We're not going through the dimples as well as we should be. Do you swing your arms when you walk though, or not really?
I don't know.
Do you have something in your hand usually, like a phone or something?
No.
No? Okay. Keep
Well,
going.
this arm has a little nerve damage. I can't really raise it right now.
All right, well, let's see. Let me see. Let me see the right side. What else going on?
Well, this arm was casted at a right angle, so when I was young. So I was always winging. So whenever I raised this arm, I always had to go out and up. You know, my body compensated.
Can you do it now?
No, I can't do it now as I had a recent, the guy that was doing ART on me. something let go, and then from that point on, I couldn't raise my arm.
Something let go
Yeah,
from ART.
yeah,
And since then you haven't been able to raise your arm.
yeah,
Before that you could raise your arm?
yeah.
Huh, okay. Have a seat.
Yeah.
Starting at the base of the neck. Here's what's interesting. If we go watch the scope, goes left, looks like it's going to stop at 6. It doesn't. Goes to the right, comes back to the left, and it breaks at the top there. 15 points, T6, T7, left side. And we're S3, S4, dude, down in the low. S3, S4, T6, T7, and C1 occiput up top is what I'm finding. Feet together, please. Open and close the knees. Your legs are long enough, so we're good there. Open and close. Open wide and close. Both of them together. Feet are touching. Good. Right side only, please. Do the right knee only. You can see the whole thing shifts, right? Because the left SI is stuck. Left side only, please. When he does the left, there is movement in the right, but it's not the same. It's harder to do the left, correct?
Yes, it's more
Yes.
restrictive.
Okay. Let's statically palpate. So we have left SI joint. Let's statically palpate and find this. 7. 1, 2, 3, 4. Tender.
Mm-hmm.
Tender.
No.
Not as bad. That's
Yeah.
the one.
Mhm.
1, 2, 3, 4, 5, 6. 6. Let's check the sacral nerves now. Back slow. Okay. Slide forward a tiny bit. Okay. Up. Sit up as straight as you can, sir. Thank you. We're going to come back into extension all the way back. That's your 5. 1, 2. I'm getting it right there, sir.
Yeah, it's a little tender.
That's 4. Not as sharp.
Mm-hmm. Yeah.
Right there.
Yep.
3 on the left. 3 on the right. I'm feeling it right there.
Yeah.
Okay? S3. T6. Now let's check the neck. 3, 2. Right there. Now, I gotta dig. If it's too much, please tell me to stop, okay?
Sure.
Yep. We're gonna do this. Let's nod the head. Let me nod. Let me do the work. That's a nod. This is the occiput. Right side. Left side. Ah! Turn to the left. Turn to the right. Primary motion of the atlas is rotation. Primary movement of the occiput is nodding. So it's not moving on that left side. Right side, it's moving a little bit. Rotation, head down, isolating the upper cervical. C1. That's not too bad. Is that sharp at all when I push?
No, not too bad.
But when I go up in here is what I'm feeling.
Yeah.
Right there.
Yep.
Okay.
You're good,
A
Doc.
little different, dude. So here's what I'm getting. I don't know how you're going to adjust. We still got to get you adjusted, dude. It's all good to figure it out, but we got to set these bones. I'm going to do sacrum and 6 to start.
Okay.
I'm going to have you walk after that. We're going to actually do it started on the high-low today.
Okay.
Then after that, I'm going to recheck to see what happened to the upper cervical. If it's still there, I deal with it.
Okay.
Okay? You ready?
Yep.
Let's rock. All right, do your best not to push your toes against the platform, sir.
Good.
Shasha? Hey, Shasha. That's a big boy. That's a big boy. Was he behaving, Shasha? Huh?
Absolutely.
All right, I'm just checking. Wait a second. If that's Shasha, who's filming? I'll let you guys figure out. If you can figure out who's filming, Shasha's here. Shasha. Now the challenge is I'm on the left side, but I got to torque counterclockwise to get the right side up. Okay, sir? Nice and easy there. That's a piece. There you go. Thanks, Shasha. 6. Oh, wow. This guy's gonna make me work. Drop the left down, best you can. There you go. He's on third right now, okay? We gotta bring him home. Walk it off, please. He's only on third though. Walk it out. But just from that, tell me if anything is different in the walk.
Yeah, it just feels more natural.
Let's go left side down and get a little more of that sacrum.
Okay.
So you know the misconception, they think the bigger people are hard to adjust. They're actually not harder to adjust. And you know who taught us that? Dr. Jose Lara, Gonstead doctor. I remember when he was adjusting Torsten. Torsten's 7'2", world's tallest chiropractor. Nice and easy. Let it roll. Let it roll. Oh, that's a piece. Come up slowly, please. Let's walk it off. What?
That was a good one.
Different though.
Yeah.
Good stuff, dude.
Well, you're moving things that haven't moved.
Yes, sir. His dimples are moving a little bit different. You know what's wild? It's so subtle, but those dimples are actually now starting to move a little bit. Put your fingers on your dimples in the back and walk. I should have probably had you do that beforehand. And you want to feel movement in those dimples. Okay, regular walking one more time. Hands on the sides now. Back over here, let's continue. All right. Good stuff, dude. Starting at the base of the neck. 6 is clear. Wow. Sacrum is clear. I'll check up top in a minute. Come back slowly towards me. Check that out. That's your 5. That's your 1. 2. That's your 3. A little different?
Yeah.
A little different. Let's do the neck. So what we're doing is we're actually doing the occiput, not the atlas. Normally you guys see me set the atlas here. And I need to bring it like that down. There. That's it. That's a tough part. Back over on the table, please. Thank you. Look to the left, look to the right, look up and down. Up and down. Nod your head, just nodding. Okay, sit back for me, please. Let me do it. Let me do it. I got a little movement. I'll take it for today. Sit up straight. Now, let's see the shoulder. Let me do it. Don't help. Don't help. I'm going to set it lightly, okay?
Mm-hmm.
Let me do the work. Don't help. Turn the wrist. That's it. Drop. Raise both hands in front of you. Let go. Let me do it. Raise it yourself. Relax. Raise it. 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 Right there. Let's go down on the knee chest table here. This is completely outside the box, but you gotta do it. You got no power going there. So passive range of motion of your shoulder is fine. So the ligaments are intact.
Okay.
It's as soon as you try to activate the muscle, everything goes weak. That's a nerve. That's a power issue.
Okay.
Let's see if we can get a little bit of power on for you.
Just head down.
Yes, please. And just relax it the best you can. So that's 2, 3. Chin down for a second just so I can get in there. Chin up slowly. Up, 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 up. Relax the shoulders into the table now. Fall in. Nice. Gotcha. Come up slowly. Nice and squishy. Walk it off again.
Good.
Go like that. Okay. Have a seat.
Just so you know, it always had to wing out before it went up before there was a problem with any nerves.
Can you wing it out then and do it?
Not really. That's.
Have a seat.
I thought it was kind of like from that cast as a young kid, like
Right.
adhesed to the scapula. When I used to surf it, this whole side of the body had to come up in order for me to paddle.
Neck is clear. Everything is clear now.
Awesome.
Last thing we're going to do is the scar tissue, okay?
Okay.
170 to 180 hertz is the frequency, 10,000 RPMs. Walk it off, sir. Last walk. Now you can tell me what's different.
Because everything is smooth. Not as much. Before it was very.
Rigid,
Yeah. It's not flowing before.
Regardless of your shoulder, you're at least swinging your arms a little bit better too.
Yeah.
So that's part of your homework with me, okay? 10,000 steps a day,
Yep.
up to 15,000, your choice, okay? Swimming is fine. I wouldn't be out paddling though, maybe just get in the water and get movement in the water right now.
Yep.
Okay, backstroke. Actually, no, you can paddle, it's fine. Bicycle is fine. Icing the areas I adjusted. At least 3 or 4 icing sessions on the sacrum and the neck. Squeeze, squeeze, squeeze. Yeah, you got power, dude. This guy's got a death grip. Relax the elbow, down. Lunate. Relax it there. Elbow. Squeeze. Elbow, relax the elbow, relax the elbow. Good. Lunate. Scaphoid. Squeeze. There you go. Squeeze. Good. Turn this way. That's for the surfing. Gotcha.
You did.
You're all set.
Thank you, Doug.
Any
That was great.
any questions?
No, you're great.
Okay.
Thank you.
Welcome to the office.
Thanks very much.